CEO of AgeWell. I'm also a professor at the University of Toronto in the area of, sorry, there's a little person appearing behind me right now. I'm also a professor at the University of Toronto, specialized in the area of technology to support older people. And I guess my newest hat is volunteering with the Canadian Standards Association, or the CSA Group, to chair the technical subcommittee that'll be developing the new national standard for long-term care homes and the facilities in which they're housed. So first off, I'd like to take this opportunity to thank everyone for joining us today. We have a tightly packed agenda over the next hour, so I'm not going to say too much, but it's great to see everyone come out and show an interest in the standard. I'd like to thank CSA Group, obviously, for being part of this session today, and also like to thank AgeWell for hosting it. So having said that, let's get right into things. We have an exciting hour planned, and I'll hand it over to Cassandra from CSA Group.
Thanks, Alex. Hi, everyone. My name is Cassandra Gullia. I'm a project manager in the healthcare and well-being sector of standards at CSA Group. I'm also the project manager that will be helping to facilitate the development of this new and exciting standard. So for our agenda today, we're just going through some introductory remarks in the next couple slides, just an intro to CSA Group and the standard that's in development. Then we're going to go into breakout rooms. There will be 3, and there'll be 1 discussion point that everyone will be working on in those groups. After the breakout rooms are closed, so you'll have 20 minutes for discussion. We'll come back together as a group and share some of the high-level findings and feedback that people give in those rooms. And then the last 10 minutes will just be wrap up and next steps. So just a little bit of an intro to CSA Group and who we are as a standard development organization. Our mission is to enhance the lives of Canadians through the advancements of standards in the public and private sectors. We're a leader in standards research, development, education, and advocacy. And the technical and management standards are developed by 10,000 members that improve safety, health, the environment, and economic efficacy in Canada and beyond. And these members are volunteers with technical expertise, lived experience, etc., to advance standards and ensure that there's equal participation and representation from the appropriate groups. So it's member driven, as I mentioned. All the standards are developed by these very highly qualified and people with technical and lived experience to advance these standards. We have 12 different areas of focus at CSA in standard development, healthcare and well-being just being one piece of the puzzle. Like I mentioned, we have over 10,000 volunteer members that dedicate their time and expertise to advance standards. There's over 3,000 standards developed to date, and that includes our standards that are developed in-house. We also have adoptions of international standards and those that have deviations. We have guidelines and other supporting documents as well in very important topic areas. And the work of the standard development is done by our committees. The work of this particular standard, the operation and infection prevention and control of long-term care homes, is being done by our technical subcommittee for long-term care homes specifically. And Alex, I can pass it back to you to give just an overview of the landscape of long-term care.
Sure. Thank you, Cassandra, for that quick introduction to the CSA Group. And whenever I talk to people about CSA Group and they're not really familiar with what they do, I always say, well, do you have a bike helmet or a ice skating helmet? Pick it up, look on the back, you see the CSA Group sticker, and that's exactly what we're doing for long-term care. I don't think I need to get much into the landscape of the current long-term care situation in Canada. We all know it's a very complex topic, and over the past year and a half, the pandemic has really shined a light on a lot of the big issues that we have in long-term care, and then the care that we're providing to the residents of these homes themselves. We probably also all know long-term care is not publicly insured under the Canada Health Act, but is governed by the provincial and territorial legislation, which obviously makes developing a national standard all that more challenging. And we are doing considerable consultations with those groups across the government, that is the federal, provincial, and territorial governments, to help to ensure that move in the right direction for a nationally adopted standard itself. Next slide, please. So in terms of the background and objectives of what we're doing, obviously with everything that's going on, not just of the pandemic, but many of us who are being involved in long-term care know these issues have been going on for a long time. There is an opportunity that was identified by the National Standards of Canada to provide greater harmonization of these services across Canada. And so the Canadian Standards Association basically is now launching this new project to develop this new national standard, which is officially called Operation and Infection Prevention and Control of Long-Term Care Homes. Now, as you notice from the title, this may not be the standard that you've heard about in the media, etc. There are two standards being developed. The one that we are doing, which is about the facility itself, including infection control, design of the built environment, heating, ventilation, air conditioning, air quality, etc. And then there's the standard being developed by HSO, or Healthcare Standards Organization, which is about the level of care and the quality of care that should be provided. And that includes anything from number of residents in a particular room to staffing levels, etc. Now, it's important to know that we are working very, very closely together, because I think we all know this, that the quality of care that may be required cannot be provided if the facility cannot support it. If the HSO standard comes out and says it must be one resident per room, well, our standard needs to be able to reflect that and to allow facilities to do so. So as you can see, there's a lot of connections between this. So I don't think today is all going to be about heating, ventilation, and air conditioning, but it's going to be very much focused on both sides. So we are definitely trying to take a resident oriented approach in the development of the standard. Next slide, Cassandra. So I think I pretty much covered most of this in terms of the topics that are going to be covered in our new standard. Obviously, the standard will be published in English and French simultaneously and available for no fee. And we'll also be planning various consultations like this one, not only before the development completion of the standard, but also afterwards as well. Next slide, please. Cassandra, do you want me to just hand this back to you? Talk about other relevant CSA standards? Thanks.
Absolutely. So in standard development, we try not to reinvent the wheel. So if there are topics that are already covered by other standards, rather than duplicating the work that other committees have done, we'll reference out to those standards. And this way, if there are updates to those other standards as well, we don't have to make edits to the current one that we're working on. So in the development of this particular standard, we will be referencing potential other standards that are have already been developed and have gone through multiple iterations by other committees. There are some standards related to healthcare facilities specifically that have an engineering background and are more about the build of the actual facility. There's also standards related to disease transmission and infection prevention and control, as well as cleaning and disinfection of healthcare facilities. There might be the potential for us to reference existing personal protective equipment standards, as well as there's waste management ones that have been developed previously, workplace management systems, etc. And in addition to looking at existing CSA standards, there are also other standards that could potentially be referenced. For example, the HSO standard that's in development. They also have some other ones that might be relevant, and any other existing guidelines and resources would also be something that the technical subcommittee would look at and look into if it's something that we could include in this standard. In terms of our developmental timelines, this is just an overview of the next about a year and a half. So currently we're working through content development. So we've formed our technical subcommittee, and we're going to be hitting the ground running and working on the actual content that's in that standard from now until November of this year. After that point, we'll be opening up the standard for public review. So the standard will be posted for external personnel to come to and provide their feedback on the clauses and the content that's in that standard. And they'll be able to provide their feedback and comments for the technical subcommittee to review and consider making changes before we publish that standard. So it's a 60-day period for public review, and we're going to make it very, very easy to find, and people will be made aware that it is available at that point in time. And it will be available, as Alex mentioned, in English and French simultaneously for people to comment on. So after public review is completed, it'll go through editorial and it'll go to final production, and hope to publish both simultaneously November of 2022. Some of you may have seen our CSA community platform. You may have been members or you may have navigated to it before. We have created an online long-term care home platform specifically for this project to keep people aware of the updates of the progress of the development of the standard, as well as be aware of any consultation sessions similar to this one that might be coming up in the future. So on that page, we have actually this event is posted for people to be aware of, and they can register for upcoming events as they do become available. We'll be updating people on the progress of the standard. So when it goes through content development, if there's questions that we have that you can comment on, we'll be posting them there, as well as any surveys, and then any progress that we've made in terms of going to public review will also be posted there. So the link is here, and I can put it in the chat as well. Following the session, I'll put it in the chat. And this way everyone can navigate to it at your own convenience and take a look at some of the updates that are there currently. All right, I'll pass it back to you, Alex.
Yep. Thank you, Cassandra, for that. And I encourage everyone to sign up for that discussion board. It's a very easy process to get a log on to there, and then you can really then post questions and see what's going on in terms of the progress of the development of the standard. So at this point, we are going to go into our breakout groups. We are essentially dividing up the group based on the three main demographics that make up the age-well community, and that are researchers, so people in academia and educators, consumers, so people with lived experiences, including residents, caregivers, and family members, and also then partners as well. So those are organizations that age-well partners with, anywhere from corporate entities and companies to providers of long-term care, and other forms of care as well. So we're going to, at some point here, magically put everyone into their rooms. Is there a next slide here, please?
I want to add, Alex, quickly. So this is, hi everyone, this is Dorina, age-well's Policy and Knowledge Mobilization Manager. The groups, some of the groups are quite full. So like the partner and researcher group is quite full, and you do have the option to move around in the groups if we've placed you on the wrong one, which is very possible. But you can also just join any group. I don't think we need to be too prescriptive about it. So just letting you know.
Great. Thank you, Dorina. Is there another slide with the, there we go. So in the discussion groups themselves, there will be a facilitator who will help to move the discussion along and keep time. And there'll also be a recorder. So no need to be taking notes yourselves unless there's something specific that you want to jot down. And what we're going to ask is the primary question here is, from your experience as a researcher, a consumer, or a partner, what aspects of infection prevention control and or operations in long-term care homes should be included in our standard? Okay. Now, while we're kind of looking at infection prevention control and operations, please don't feel completely constrained to these two areas, because again, environmental design, size of rooms, other aspects of long-term care homes, all are going to impact these things. So again, through the moderation facilitation, we'll ensure that we consider this in a very holistic approach. Is there another slide, or is this?
That's it. Yeah.
We're magically now going to go into our room. So what you should see on your screen is a little box that appears. Great. Well, welcome back, everyone. Hopefully you had a good discussion. Again, just up on the screen is a reminder of the question that we were all asked. So at this point, really, I want to hear from the three different groups, not in a formal way. I'm not asking the reporters or anyone to give a report back, but really just to kind of hear the various issues that came up. So first, let's hear from our researcher group, and anyone can pipe in here from that group. What were some of the main topics that came up in your group?
Maybe the person that took the minutes.
Yeah, I was
out.
gonna say,
Yeah.
maybe we can start off with the recorder or the facilitator just to kick this off with some of the key points.
Sure. So some of the key points that came up for us was capturing a home-like environment versus a clinical environment, and considering a balance and trying to have some normalcy and really integrating safety into everyday activities. That was a point that came up a few times. We also had equitable and universal access to the building, making sure furniture reflects people with different abilities or lack thereof, and making sure it's equitable for everyone, considering a stay-at-home staff or team to avoid infection spread. Also considering materials for management of behavioral and psychological symptoms of dementia, including physical restraints. And considering medication standards and equipment, especially important for patients who have cognitive impairments. Those are a couple of key points that came up.
Great, thank you. What about from the consumer group? Again, why don't we just start with the reporter or the facilitator or both?
Yeah, I can speak to that one. So a lot of great discussion and personal accounts as well. One large thing that came up was innovative care home models. The butterfly model was mentioned, and I see it in the chat quite a bit. People are saying that it's a great best practice or thing that people can start to look at. So some examples of good operating procedures in homes. There was mention of a lot of training needs, in addition to ongoing training for staff. Also, there are concerns regarding patients that might be the wandering type and having some sort of restrictions or policies in place to ensure their safety and that no harm comes to them. There was also mention of need for policies around family visits and making them inclusive and not having strict isolation rules to ensure that the resident gets the support that they need from their families and their caregivers. But education was a large one that came up across the board, as well as ensuring that the residents in the home have the technology and tools at their fingertips to stay connected to the external world. Even if there are cases that come up in the home, they need to be able to call out to their family members through a phone line. Even if they change rooms, they need to have that phone available, as well as any other tools like Wi-Fi and internet as well. And I'll stop there just to be cognizant of time.
Sure, great, thanks, Cassandra. And the final group, the partner group, I was the facilitator, so may I'll hand over to our reporter if she doesn't mind.
Sure. We had very similar discussions around both what Cassandra and Carolina said. Big one was balance between the standards and creating that home life environment. Someone pointed out that it shouldn't be home-like, it should be a home environment. That's what we're really striving for. And on that, the importance of having the family caregivers or ECPs be a part of those standards, a part of those plans fully, not just as a side piece, but fully implementing them into the standards. In terms of infrastructure, we talked about that digital infrastructure, so making sure the internet capability is not just at a minimum, but that it actually works. Having digital care records to have more analytic capabilities, have more records and monitoring systems for tracking cases, as someone mentioned, a dashboard type thing. Also for infrastructure around furnishings, so standards on making sure that furnishings are able to be cleaned and sanitized properly. We also talked about other models and how we can use this as an opportunity to not just look at COVID, but look at beyond COVID. So how can we implement some of these other care models like the butterfly one, dementia villages, and how can we make sure that those standards support these new models, but also support older models and older infrastructures, so no one's left behind in that. And then also making sure standards support staff specifically.
Great, thank you, Brooke. So thank you to all three groups. Sounds like you had some very rich discussions, which are great, and obviously a lot of overlap. So at this point, it's really open to general comments or questions. One thing I'll say is feel free to use the chat to put your own comments in there as well. We will record the text in the chat as well for our own notes as well. But at this point, why don't we open up to any questions or comments anyone may have. You can try the raise hand function or just wave at me or just speak up. Yep, Rob, did you want to say something? You're on mute now, Rob.
Yeah. How will the standards be enforced?
That's a good question. So, you know, all the standards are voluntary unless the government chooses to do otherwise. So that is one issue. The other issue, as we mentioned before, is, you know, we hope that it is a nationally adopted standard. So how do we get all the provinces and territories on side as well? So those are questions we need to look at and try to think about moving forward. But unfortunately, right now, there is nothing that mandates this as an enforceable standard right now.
And the standard, unless it's enforced in legislation or the regulations, it is voluntary. That being said, any facility could decide to take that standard and adopt it as their own and put it as part of their standard operating procedures and follow compliance within their own organization. But to Alex's point, unless it's something that the government decides to make part of the legislation, it would be up to each facility as to the intent to adopt the standard.
Thank you, Cassandra. Any other general questions or comments? Yeah, Rob, go ahead.
Perhaps one way would be to have some kind of financial incentive for the homes that put the standards in place, and like lower insurance,
Yes.
or something. That's just a suggestion. Yeah,
and that's a great point, Rob. And in the recent federal budget, there was a significant amount of money in that budget to support national long-term care standards. Now, maybe someone on the call is more informed than I am, but I'm not aware of how that funding will be used. Will that be incentive money that goes to provinces that are willing to adopt and enforce the standard? Is it money that goes to individual facilities? I have no idea. Does anyone have any information on that beyond what I just said?
Alex, I don't have, this is Mary. I don't have information on it, but I raised the discussion with my MP, and it's really $3 billion over 5 years, so $600 million a year. When they allocated $30 billion for childcare, and the 6 million seniors and 3 million kids. So I said it's 1/10 of the budget and 5% on a per capita basis. And I got a feeling to actually fix the system is going to take a hell of a lot of money, and they're not ready to make that commitment yet.
Yeah.
So they're making a very small step, but they haven't gone all in. That's the discussion. My feeling, not actually spelled out so much, but my feeling from the discussion with my MP.
Yeah, and I agree with those sentiments, Mary, and I'm completely alongside you there. So the way I see it, as you know, chairing this group, is we have to make a standard that is so compelling, so reasonable, and so nuanced that it works for as many people as possible and as many facilities as possible that it just makes sense to adopt, right? It's kind of, as an academic, I always aim to write a grant that, well, of course they're going to fund this because the thing is so well written and such a compelling argument. Same mentality in this as well. Mary? Yep. Yeah, your hand up.
I think there also needs to be a parallel discussion of other options than long-term care for people to age in the community, because it's expensive for long-term care. The cost is very high, and a lot of people would prefer to be in the community. And one of the things, the home care model has some issues with the agencies. And one of the idea I've been trying to write a policy proposal for is to potentially swap 15 hours of agency help allocated by the health authorities, which is 60 hours a month, for subsidy towards living help. That would actually give people, a lot of people out of job who don't have enough money for a place to live. And so this can be a win-win-win situation, especially we had to train a whole bunch of healthcare workers, nurses, PSW, etc. How are you going to live while they're being trained? So this is one option where, if they say they'll commit to a year or a nurse a few years to be living help for a senior or a senior couple, they still can do the training if there's programs that can match the timing. So some are daytime if they're doing evening, or some are in evening they're doing daytime while the family members are at work. Right. I'm saying we need to look at win-win situation and not just silos, and looking across the board. Sorry.
Yeah, great. Thanks, Mary. All right, so we have a few minutes left in the session, and I actually want to put our Age Well hosts on the spot. Particularly Dorina. I know I'm wearing an Age Well shirt. I just switch the patch depending on what meeting I'm in. But Dorina, do you have any thoughts? So Dorina, may you introduce yourself quickly and then
yeah, sure.
Comments.
So I'm the Policy and Knowledge Mobilization Manager at Age Well. I think I mentioned that earlier. I think the conversation here is really important, and it's one of many. I appreciate the comment on the federal budget, and it is, from my understanding, and I welcome any corrections on this. I believe it is $4 billion if we include the $1 billion announced in the fall economic statements that should be through to the Senate now. These things take time from a policy perspective, right? The current federal budget that was announced is going to take some time to go through the legislative process, and for the money to be allocated and really earmarked appropriately. So I think the timing of that and the work of the standard, there's an opportunity there, right? Because we can kind of inform some of that through what we're hearing in consultations like this one today. From an Age Well perspective, we are working towards including the technology aspect of this into the standard, and also figuring out what are the best ways to implement technologies into long-term care settings. And that is a broad definition, right? We always talk about age tech or technologies for healthy aging as anything from the glasses on your face to, sensors and smart home systems and fall prevention technology, that kind of thing. So that's all I'll say for now. I'm really looking forward to hearing for what anyone else has to say. Folks like who know Age Well, like Phil, and really nice to see some familiar faces. So.
Yeah. Great, thank you, Dorina. And there's a lot of great chat happening in the text window, so thank you for that. The final thing I'll say, maybe before I ask Cassandra if there's any final comments from the CSA perspective, is we've talked a lot about the technical subcommittee. So those individuals that'll be working together to develop the standard. We also, though, have been advertising our working group for those with lived experiences. So residents, older people, caregivers, family members. we put that information out before on social media and through our websites. Maybe Cassandra, I don't know if there's a way of posting the PDF or something here, but if you want to be part of that working group, that is also an opportunity to have direct input into the standard itself as part of this official group that we're putting together. And we're taking applications still for the next little bit in order to get this working group together by the end of May, and to start to work hand in hand with the technical subcommittee, providing us input as needed. So we'll try to get that information out somehow. And
yeah, it won't let me add a file.
So
I can try to do you have a link to it, or just email it to me, maybe Cassandra, and I can,
Okay,
we can also
sure.
just email it to all participants after.
That would be great. Yeah, we could do that.
Yeah. So maybe what we'll do is we'll send it to everyone who's in this group today. And if you have not seen it before and would like to be able to join that working group, that'd be fantastic. So that's it for me. Cassandra, anything else from the CSA perspective?
That's exactly what I was going to mention, was that working group, because I see there's a couple people with comments about the need to have lived experience as part of the discussion. So that's really going to be where we have a lot of discussions with people that have that lived experience piece. So I'll make sure that we get that out to everybody for your consideration. But thank you, everybody. These discussions have been fantastic. And if you think that there'd be any additional sessions that we could benefit from, or topics that you think we could look into, feel free to reach out, and we can have further opportunities that come from that.
Yeah, and one thing to add to that as well is, if you are a representative of an organization of some kind that would like to host your own session like this with your own constituents, please reach out to us as well, and we're happy to organize and work with you to do that. Transparency is the key over the next several months with this whole thing, and that's our objective. And the way of doing that is through partners like AgeWell and others. So thank you very much, everyone.